address underage drinking. Today's event is the 6th webinar in the Preventing Underage Drinking webinar series offered by the Federal Interagency Coordinating Committee on the Prevention of Underage Drinking, otherwise known as ICPUD. Today's event is being hosted by the U.S. Department of Education's Office of Safe and Healthy Students. My name is Greta Colombi. I'm Deputy Director of the National Center on Safe Supportive Learning Environments, and I will be your moderator for today's event. To start the webinar, I'm going to briefly discuss a few technical details, learn a little bit about those of you participating today, introduce our speakers, and then hand the session over to them. Over the course of today's webinar, we will periodically pause to answer your questions. You can type your questions into the Q&A pod on the right-hand side of your screen. There will be a Q&A opportunity after each speaker concludes their presentation, but feel free to enter questions related to today's material at any time. Because we may not have time to answer all of your questions you submit, the National Center on Safe Supportive Learning Environments will prepare a document that includes the presenter's responses to all of your questions, whether they're addressed during today's webinar or not. To receive this document, email ncssle@air.org. This address is currently at the bottom of your screen. The document will be sent to you once it is publicly available. Alternatively, you may return to our website in the future to access the archived webinar and complete Q&A document at http://safesupportivelearning.ed.gov. At the conclusion of the presentation, you'll be directed to a short feedback form. Please take a few minutes at the end of today's session to fill this out and let us know how to better provide the resources you need. Note that there are 3 slides of these questions to the feedback form, so please do complete them all before departing from the webinar. Also, you will notice citation numbers listed on the lower left-hand corner of some slides during today's session. These numbers correspond to the list of references and resources included at the end of the presentation. To learn more about information presented on a particular slide, please consult this reference list. Also, please note the file pod on the top right sidebar of your screen. There, you can download the presentation slides and presenter bios. In addition to stopping to take your questions, we will be using a couple of polling questions to help you learn about who else has joined the event and to help our presenters know what points to emphasize and which ones to quickly review over the course of the presentation. So we're going to start this webinar with 2 quick polling questions. Which of the following best describes your current role? Are you an alcohol and other drug prevention specialist, a health education, health services, mental health services representative? Are you coming from campus police, residential life? Are you faculty, a campus administrator, from student affairs, an athletic department, a student organizational representative, a community member, a local government, police, or fire representative, a parent, or other? So again, it's wonderful to see you all participating and seeing our numbers grow here. So far, it seems like the majority of the folks on our call today, on our webinar today, are alcohol and other drug prevention specialists. We'll just wait a couple of moments so that we can give as many of you the opportunity to participate as possible. The next largest group appears to be the health education and health services and mental health services representatives. And we have a few folks from student affairs and community members. So we're going to go to our next polling question. In just one moment. And basically, we would love to know which of the following best describes the primary reason you chose to participate in today's session. Do you have a personal interest in the topics discussed in the webinar? Have you been charged with the task of addressing the topics of this webinar in your organization? Are you a member of a coalition or collaborative which is addressing the topics of this webinar? More than one of the above or other? So far, it looks like a good portion of you are members of a coalition or collaborative that is addressing the topics of this webinar. The next largest group so far seems to be more than one of the above. We'll just wait a couple another moments to give you all more of an opportunity to participate. Looks like it is quieted down. But yes, it looks like consistently many of you are members of a coalition or collaborative. So thank you very much for participating in our polls. During today's event, we will be featuring 3 distinguished speakers. First, David Esquith, Director of the U.S. Department of Education's Office of Safe and Healthy Students, will start with a brief welcome. Then, Dr. Tracy Toomey, Professor at the University of Minnesota's Department of Public Health, will be next. Dr. Toomey will share the latest research and thinking on reducing underage drinking via collaboration. Next, we will have Nicole Holt. She is Executive Director of Texas Standing Tall. Ms. Holt will feature statewide collaboration efforts in Texas. And last but not least, we will conclude today's webinar with Carrie Calvert, Health Promotion Coordinator for the Bloomington Normal Community Campus Committee. Ms. Calvert will share how her Indiana community has been collaborating to prevent and reduce underage drinking. For information about each speaker, please again go to the file pod at the top right corner of your screen to download their bios. And also please note that the content of this webinar is solely the responsibility of the presenters and do not necessarily reflect the views, opinions, or policies of the Office of Safe and Healthy Students, the U.S. Department of Education, or the ICSID agencies. So without further ado, I'm going to hand it over to our first speaker, David Esquith.
Well, thank you, Greta, and good afternoon, everyone. It's my pleasure to welcome you to this webinar. In this webinar, we will explore the important role of community coalitions and prevention research that strongly supports the use of comprehensive, integrated programs with multiple complementary components to address underage drinking. It includes a special focus on the role of the secondary and post-secondary education sectors and the role that they play in ensuring the success of community coalition efforts. Community coalitions are critical to our nation's efforts to address underage drinking and youth illicit substance abuse more generally. The Drug-Free Community Support Program is a federal grant program that provides funding for these community-based coalitions. Education is a required partner in these local coalitions. The philosophy behind the program is that local drug problems require local solutions and multiple partners. The coalition model includes both grassroots and grass tops community organizing simultaneously to build support for environmental and individual interventions. Recent evaluation data indicate that where these grant dollars are invested, youth substance abuse is lower. Over the last 20 years, the Department of Education has invested in reducing underage drinking through numerous grant programs and through the provision of technical assistance resources. These investments have often been a component of broader community coalition efforts. I encourage you to explore some of the resources related to underage drinking prevention that are now housed on the website of our National Center on Safe, Supportive Learning Environments. Just type safesupportivelearning.ed.gov in your web browser to get to the website. In closing, let me thank the presenters for taking the time to share their research and experiences with you, and thank you for joining us on this very important topic.
Thank you very much, David. That was very helpful, and I think a wonderful way to set the stage for today's presentation. Thank you very much again, and now I'd love to turn it over to Tracy.
Thanks, Greta. I'm very pleased to be as part of this webinar this afternoon to talk about a really important issue, which is underage drinking. But I want to make the point that the reason we care about underage drinking is because those youth who drink and drink heavily experience a wide range of problems, from traffic crashes to sexual assaults to sexually transmitted diseases, unplanned pregnancies. The list is actually quite long. And that needs to be, I think, our ultimate goal. And that is, why we're here today, to to work together to figure out how do we prevent those types of problems occurring among our young adults and our adolescents. If we're going to address underage drinking and solve some of those problems or prevent some of those problems, it is really critical that we collaborate and we bring a lot of different people and organizations to the table to work on the problem. And the reason that collaboration is so important is that this is not a problem that a single institution is going to solve, or there's not a single age group. I mean, we're talking about young adolescents, we're talking about high school students, we're talking about college students. And so even if we do our best job on a college, for example, on one college campus, we're missing a whole wide range of other age groups that are at risk for these drinking problems. And a good example of the commonality of problems is that you could be worried about college students, and someone else could be worried about high school students. But it turns out that the high school students and the college students are drinking in the same place, in a party house in a local neighborhood, and that would be a great thing to collaborate on to solve that problem. The other reason we need to collaborate is that even if we do the best job on our college campuses or within our high schools or other institutions, we can't ignore the fact that the communities and the states that our young people live in greatly affect the likelihood of whether they drink or not. And to change community and state policies and environments, we need to work together, because it's going to take multiple voices, multiple skill sets, and we need to work together to have the political power to change the status quo. There's a lot of economic interest in keeping things the way they are, and if we're going to make a change, we actually have to work together. When we talk about collaborations, I think they're so important, but I have seen over the years, I've been working in this field for 20 years, and I do sometimes think that I've seen organizations stop and say, well, we've built our task force and we've built our collaboration, and that's great, but sometimes it's become the end point. And I think we have to remember that just collaboration is not an end point, it is a means to reaching our goal, which is to reduce underage drinking and to prevent the problems that young people face as a result of their drinking. When we talk about addressing drinking, underage drinking, I think it's important to think about, well, what factors contribute to the likelihood that a young person will drink or not drink? This slide shows a model that was developed by Alex Wegener and Cheryl Perry years ago, and I put the slide up to illustrate the point that it is complicated why a young person might choose to drink. On the right side, you see the macro or the individual level factors. That it could be their knowledge, their attitudes, what they believe about alcohol use, and if it's going to make them sexier or a better athlete or whatever. And we can address those individual level factors, but if we stop there, it's unlikely to create a sustained reduction in drinking and related problems. We have to also keep in mind those factors that are on the left, the macro or societal level, the environment in which our underage individuals are living. So those policies and practices and marketing practices may influence the likelihood if they drink. My next slide is just kind of a simplified version just to emphasize the importance of the environment. And today I'm going to be talking a little bit about availability, which is what the research has shown to be a critical part of the environment in which young people live. We know that as alcohol becomes more available, the rates of consumption increases, and so do the rates of our problems that are associated with alcohol use. And so we're always trying to figure out what are the most effective policies and programs to reduce the availability of alcohol. When we talk about availability, that actually is a very broad term, and we have several different types of availability that we can talk about. The first is legal availability. When we talk about legal availability, usually we're talking about the minimum legal drinking age. In the U.S., of course, we have an age 21 drinking age. Other countries have different minimum legal drinking ages. We do know from our history in the U.S. and the research that has been conducted that the age 21 drinking age is associated with less alcohol use among young people and young adults, and also associated with fewer problems, including traffic crashes and vandalism and a range of other types of problems. So it's really important that we maintain our age 21 drinking age in the U.S. We can also talk about economic availability. What's the price of alcohol in your community or in your state or in your country? We know that young people are particularly price sensitive, meaning that as the price of alcohol increases, alcohol use goes down, and so do problems related to alcohol use. So we often talk about, well, how can we raise the price of alcohol, even just a little bit? And we might see reductions at a population level of drinking and related problems. We might do this, raise the price by raising the excise tax on alcohol at the state level or at the federal level. We could set a minimum price limit. We can, get rid of deep discounts in our communities or in our states or in our country. So there's a wide range of ways we can reduce economic availability. We have also social availability, and for me that represents like how pervasive is alcohol in our communities in our state. So that can be how it is marketed, how pervasive are the advertisements. And we need to look at what ways we can put some limits on the amount of exposure that young people face in terms of the advertising and the type of advertisement they're seeing. And then we have physical availability, which is really how easy is it to get alcohol physically. When we talk about underage drinking, we often talk about the source of alcohol. Where are young people getting their alcohol? Is it from bar, restaurant, liquor store, or convenience store? Or is it from a social provider, a parent, a friend who's 21 or 22 years of age? There's a wide range of sources, and it varies by age group, it varies by community and state. So when we're trying to work together to solve the availability of alcohol for young people in terms of the source of alcohol, it's important to know where are they getting it in your community and your state for the age group you're looking at. We can also talk about how many alcohol establishments are there around a campus, whether it's a high school or a college or in a neighborhood. How dense is the alcohol establishments? The greater the density, the more alcohol use there is, and the more problems there are. And then there's also things like the hours and days of sale. The more hours we sell, the more days we sell, the more available alcohol is, and the more likely we will see more problems. So there's a range of different ways that we can affect the availability, and we do it through policy changes and enforcement and a variety of other type of environmental changes. So we need to say then, okay, if we have some ideas of possible solutions and to change the environment, how are we going to do that? Well, I want to first make the point that there is no curriculum. I've been in this work a long time and had many phone calls where people have asked me for the curriculum, how to make an environmental change. And the good news is today that there are actually a number of tools and training programs, I think, to help people do this work. But there's not a step-by-step approach that's going to lead you every step of the way. But there's general guidelines for the process and the techniques that you can use. But there is not a curriculum because, again, the problems are going to vary by the community, the state, or even the country that you're in, and thus the solutions are going to be different, and the political context is going to be different. And so you need to be strategic to think about what's the best solution for the problem you are trying to solve. And it's really important that you involve staff and volunteers who are strategic and can help the people collaborating together to figure out how to make those environmental changes happen. Today I'm going to just briefly touch on two approaches that are often used to build collaborations to make those types of environmental or policy changes, again, to ultimately reduce underage drinking and the problems that young people are facing. The first, coalition building. I saw in the poll that many of you are involved in coalitions, which is terrific. The second thing I'm going to touch upon, the method I'm going to touch upon, is grassroots community organizing. And I know many of you on the line are probably familiar with that process, but I want to make sure that everyone on the phone is aware and can think about using that strategy maybe along with your coalition. When we talk about coalitions, this is a collaboration that is usually organizations working with other organizations, working toward a common goal. So in this case, working towards reducing underage drinking and the problems young people face as a result of the alcohol use. These coalitions can be temporary. I've seen some coalitions come together for a couple years to try to raise the excise tax on alcohol. When they accomplish that, maybe the coalition disbands. And there's other coalitions that last for many years. If your goal is to reduce underage drinking, obviously we're not going to solve it with one program or one policy change. It's going to take a significant amount of work over a number of years to continue to make a dent in the underage drinking problem. So those coalitions most likely will be a long-term collaboration. We build coalitions, obviously, because we can't usually win alone. When we're talking about a policy change, it actually takes quite a bit of political clout or power to make a significant change in a policy, or even a significant change maybe in getting increased enforcement of existing policies. And so by working with other organizations, we hopefully increase our resources in terms of maybe financial resources to hire staff, but also maybe resources in terms of membership to activate, to call elected officials, to put some pressure on them to ultimately change the policy in the direction that you want it to be changed. If you're talking about state level change or a federal level change, you need to work with organizations across a wide geographic area so that you can influence elected officials throughout the state or throughout the country to, again, achieve a sufficient number of votes to get the policy enacted. There are some challenges of coalition work. I've worked with coalitions over the years, and I think this is not uncommon, is that sometimes there's inequality of power where some organizations may have more influence because they provide maybe more financial resources. So it's really important to make sure you know how the decisions are going to be made and that all the organizations are on board for how those decisions are going to be made. It can certainly distract from your organization's other work if the coalition work really takes off. And so your organization up front needs to think about how to handle that when you're working with the coalition. Sometimes I've heard of coalition members being frustrated. You take a vote, what strategy are we going to go after? And it may be a weaker strategy than you would work on alone. So each organization has to decide, how are they going to be involved in that coalition and deal with those types of situations. My last bullet is one I really wanted to emphasize. I have been involved with a number of coalitions over the years, and I've felt some frustration sometimes where I felt the coalition hasn't moved towards action. Always waiting to take action until we added another organization, or we just didn't have strategic discussions to move us forward. And so it's really important to make sure that when you have the collaborations, that these are valuable resources and time, and you want to make sure that you're moving strategically towards making the change. Again, our goal is to reduce underage drinking and the problems experienced, and we can only do that if we take action. With grassroots community organizing, it's slightly different. It's usually not bringing organizations together as much as bringing individuals who have a shared self-interest. In this case, it may be underage drinking or making a community safer. We use community organizing because a key part of community organizing is building leadership within communities or within states. The people who are affected by the problem are the ones that help find the solution. And so it's about building the leadership among those people, bringing individuals together for collective action. It's not just professionals necessarily coming together. It can be parents, it can be local citizens concerned about the issue, coming together to put external pressure on key decision makers to get the right policies in place or the right enforcement actions in place. And it's being very strategic and action-oriented. Again, keep in mind that this is not necessarily, it doesn't mean that you do this and you don't do coalitions. Some coalitions are statewide, and they may use grassroots community organizing to address issues in specific communities. And so you can combine the two approaches. There are a variety of different stages that you use with grassroots community organizing. This is from our CMCA project, which is a model program. I don't have time to go through all of those stages, but I want to emphasize a couple and know that there are other models that are out there, but they're usually very similar steps. The first stage or step is to assess your community. I can't emphasize how important it is to understand what your college or high school or community or state, what is happening? What are the problems that you need to address? So if it's underage drinking, college students, where are underage college students getting their alcohol? How expensive is alcohol in the community surrounding your college? So it's trying to figure out what are the problems. And then figure out who has the power to make the change. And are they with you or are they against you? And so you need to really understand that context, understand the solutions and the problems, and then identify the appropriate solutions. Part of this stage is also doing one-on-ones, and this is really a critical stage of community organizing where you have discussions with individuals throughout your community. If it's on a campus, it could be done throughout a campus, even throughout a state. And they're not interviews. It's sitting down with individuals to figure out what concerns they have, what motivates them. You exchange information with them about what you're working on, why you're working on it. And you build relationships with people and identify who's with you, who's against you, who could be a member of your core team. And the recommendation is to do 100 to 300 of those within the first few months to start to do that assessment work. Through the one-on-ones, you identify your core team members, maybe 8 to 10 people. And these are the people that are making the day-to-day decisions, and they're going to be the leaders in this campaign. You're also going to find the people who, if you need to pack a city council room, these are the people that you can call in this broader base to help pack that council. And through this next stage, you're also building community awareness around the issue that you're working on. The next stage is to develop and implement an action plan, keeping in mind that it's community-driven and policy-focused. It's solving the problems that community needs to address. You implement that action plan in the next stage and know that if you hit a roadblock, you go back and you revise your action plan, but you're always moving forward strategically. There are challenges also with community organizing. It's hard to find time to do sufficient number of one-on-ones, and so you have to figure out how do you make it possible, give the resources to your staff to do it, or time for you to do it yourself. And I think you have a small core team, and so sometimes there's burnout, and so you always have to remember to recruit new individuals, develop new leadership to avoid that burnout. Considerations for both coalitions in organizing, again, is the importance of being action-oriented. Sometimes I've seen both through grassroots community organizing, coalition building, that the teams do activities, but it's not activities that are strung together in a strategic way towards a specific environmental or policy change. So you want to make sure that you're always stringing together things and ask the question, why are we doing this? Is it going to move us towards our desired goal? A key part of doing this work is having an organizer, a coalition director who's good at building relationships and conducting those assessments and building leadership, and that a person that can help the team be focused, action-oriented, and, again, very strategic. I just wanted to emphasize that there's a growing body of research literature showing that changing multiple environmental strategies alone or in combination with individual level strategies is making a difference, reducing rates of drinking and related problems among underage youth, college students, and the general population. And these are, I'm just highlighting a few examples. I cite a couple review articles that describe each of those studies. And keep in mind that they use different types of strategies because they're solving different problems, and some use coalition approaches, and some have used an advocacy approach, or I can't remember if it's coalitions or grassroots organizing. And it was a variety of approaches. A consideration when you're doing collaborations, again, I think the resources are so valuable when you're bringing them all together, and it's really important not to waste time and these resources on interventions that have been shown through research over and over again not to work. We want to make sure that we're choosing strategies that will make a difference at a population level. and we want to put our limited resources into efforts that we know are going to make a difference. And keep in mind that this is an adapted quote from Aristotle, that talk alone moves nothing, only talk that is tied to action can do so. And I'm going to modify it a little bit more and say talk alone moves nothing, only talk that is tied to strategic action can do so. And so that is what we're always trying to do, is move forward, again, to ultimately reduce drinking and the problems that results from underage drinking. So thank you very much. I appreciate your listening to me, and I'm happy to answer a few questions.
Thank you so much, Tracy. It's amazing how you were able to get so much great information in such a short amount of time. You did a wonderful job. We do already have a couple of questions in queue. For those of you who would like to ask any questions, please again enter your question into the Q&A pane, which is in the on the right-hand side of your screen in the middle. So we have our first question about social availability. And I'm just going to jump up to the slide where you talked about that. If I can find it. Oh. Yeah. No. Okay. You talked about social availability.
Yeah, I didn't have the best slide for it here, but what is the specific question about availability?
Yes. They're wondering whether social availability also includes community or cultural norms.
I think that I would not say that that is a direct source of availability, but certainly indirectly it influences it. And so if I'm going to pick, this is again where it's really important to think about your particular community or population you're looking at, because it may be that alcohol is very available at certain events, and those events are very important for that particular culture. So how you address that problem, you might need to address it, but you need to be to recognize the cultural influences, and that might change how you.
Oh, Tracy, so we have heard examples of, Patricia has heard examples of moments when parents or community members have mixed messages. So they might say, kids are going to drink anyway, so we will take their keys and let them party safely in my basement. Do you have any advice on how to handle mixed messages that folks may be giving youth?
Yeah, I think it's a challenge to figure out how to have consistent messaging, but I think you have to kind of address that point, this issue in a straightforward way. I think parents really do think they're doing a good thing by providing alcohol at a party and taking away the car keys, that they're creating a safe environment. But it's really important to, to make sure that the parents understand that when parents give permission to kids or their other kids to drink, they're increasing likelihood that those kids are going to drink more someplace else outside of the parent supervision as well. And that parents have a hard time sometimes creating a safe environment. In Minnesota, we had a death tied to a parent who had a party, and then the kid still got the key and drove away and was in a car crash. So, we need to make sure that we increase awareness of the risk of doing those type of things that we think are for good, but to make sure that everyone knows that they do increase the risk. And so I think by making sure we increase awareness and understanding of the whole problem, maybe we can increase the consistency of the messaging over the long haul.
Thank you, Tracy. And we have a few other questions that I just want to ask. One more, and all the others can be addressed in the Q&A document later. Lori asks whether there's an assessment tool or questionnaire available to use with college students. She had mentioned that in high school they use the PRIDE survey.
In terms of doing an assessment of who's drinking, or in terms of where they are or where they're getting their alcohol?
They don't
Maybe I'll.
specify, but
So there's a variety of tools out there. There's the core survey. There's some colleges develop their own survey. In our work, we've used the college alcohol study survey that they used. So there are instruments out there, but I would have to, outside of this call, look for specific references to those sources.
that would be wonderful, Tracy. Thank you so much. And as I had mentioned in the introduction, we will be creating a Q&A document. For those of you who submitted a question, we'll either ask it during the next Q&A period or make sure that it's included in that Q&A document that we will post on our website and also on the ICPUT website for this webinar series. So thank you again so much, Tracy. Now I'm going to turn it over to Nicole Holtz from Texans Standing Tall.
Hello.
Hello.
Thank you for having me today. I appreciate your inviting me to present. Texans Standing Tall is a statewide coalition, and we are doing the type of work that Tracy just discussed with us. And so I will primarily be discussing in broad topics how we as a statewide coalition do our work. So with that, I give you an overview of our vision and our mission. Our vision, as it's presented here, focuses on the word irrelevant, and we think irrelevant is an important word because we believe that alcohol, tobacco, and other drugs should be as important to young people as taxes and mortgages are, and we feel that those are pretty irrelevant in most college students and high school students' lives, and so should substances that are unhealthy for them to use. And the way that we go about our work is by creating healthier and safer communities. We want to see a healthy and safe place for young people to live and grow, and if that occurs, then we believe that they're less likely to use the substances that cause them harm. So a bit about Texans Standing Tall. We started in 1997, and we were one of the Robert Wood Johnson Foundation's 12 coalitions to reduce underage drinking, and we were created, as I said, there was one of 12 coalitions in the country that were created by Robert Wood Johnson to do this work. Our coalitions were administered by the American Medical Association, and we were focused exclusively on preventing and reducing underage drinking. We had to be statewide, and we had to conduct environmental strategies, and we were forbidden, not allowed to lobby. So many of you who are involved in coalitions will be familiar with this. In 2004, we expanded to include tobacco and other drugs as part of our mission because we were no longer only funded by Robert. In fact, our funding ended from Robert Wood Johnson Foundation, so we had other money that we could focus on other issues. And in 2009, we became a standalone nonprofit, and we operate in the form of a coalition. We have committees and work groups and statewide representation from state agencies and statewide organizations, as well as regional groups and local coalitions. And the way we often describe how we go about doing our work is we keep our eye on our mission and vision, and we select strategies that we believe will chip away at the problem. So we seek out funding by having a plan of action and knowing what our gaps are that are hindering our success. And as Tracy indicated, we do string together our work in a strategic and an intentional way. To kind of give you a little bit of how Texans Standing Tall operates, you can see here in bullet points that we're kind of focused on the different activities, kind of the way that we do our work, and not so much activities themselves. So we are statewide and we are data-driven. So for instance, we know, not just because our gut tells us this, but because the data tells us that both among high school and college students that alcohol is the substance that they most use. And then we look at what strategies among the data, we begin to seek out strategies that will impact what the data is telling us. So we also know, because of the data that has been collected, that the likelihood that a person is going to get get alcohol from a social setting, like a party or a friend, is really high. And so we then align ourselves for focusing on multiple strategies. So we pick strategies that are evidence-based, and then we focus them based off of long-term, intermediate, usually short-term goals, or what we might call quick wins. And so some examples of that would be alcohol excise taxes. That might take us 7 to 10 years at the state level to work on, and that would be long-term. While addressing social access through local and regional efforts might be intermediate, and that might take us 3 to 5 years to begin to see local communities passing local ordinances or something like that. And then we would look at more quicker wins between 3 to 5 or 1 to 2 years. And those things might be, as we move from intermediate goals, which are more like 3 to 5 years, moving into more quicker wins, which would be 1 to 2 years, would be something like addressing, getting more college campuses to utilize data collection techniques, or to utilize screening and brief intervention more regularly on their campuses, or things like that. So how we go about doing our work includes engaging the community in capacity building. And so this slide is specific to the college work that we have conducted. And so throughout our existence, we've worked on college campuses. And one of the things that we have done is really focus on building capacity of the community and target sectors that we need to build capacity in order to do our work. So when we think about what we can do on with college campuses and among the communities that colleges are placed in, we can hold judicial think tanks, for instance, with the judicial officers or judges, college presidents forums and think tanks. The college and university symposium and teen trainings are primarily focused on working with students and campus professionals. Report cards, that is a real way for us to increase knowledge of a problem among our state as well as among decision makers. And more recently, we've created a specific report card on higher education. We use regional forums as a way to build capacity and collaboration among grassroots and community leaders. And we found that our college regional forums were very effective at increasing communication among neighbors and college communities. And, in Texas, there are nearly 200 college campuses with accredited 4-year and 2-year schools combined. And with screening and brief intervention, we found that there were a lot of smaller campuses where there was not a judicial office or a health office where naturally screening and brief intervention would be occurring. So we started looking at how can we really expand the use of screening and brief intervention on smaller campuses and attempt what we would describe as upstream prevention. So those are some of the ways that we began to engage the community around addressing college issues and to build our capacity. And to be a little more specific around some of those activities, the next slides that we'll talk about kind of highlight the report card and regional forums in particular. So in this case, our annual report card, it's really a readiness building tool. This particular tool is a way for us to increase knowledge of the subject by lay people. So we're really focused on its functionality. So as Tracy was saying, building our capacity and being able to be grassroots organizers really requires that people have some knowledge about the problem that's steeped in data and knowledge about the solution that is steeped in what the research says works. So for instance, the functions of this report card were, and for really all our report cards, is for us to focus on what's the current research trends and what do elected officials do that impact our prevention efforts. So if we need to know, in order to make a decision around a strategy, what the age of first consumption is, or use by demographics, or what kind of evidence-based solutions and strategies would actually impact college student drinking, especially if first-year students or athletes or students involved in Greek society are somehow more likely to be at risk. How do we select strategies that would impact effectively protecting those populations? And so we begin to talk about things within our report card, for instance, that elected officials may do during our legislative session, because they make decisions about what kind of prevention gets funding and what kind of, if marijuana is legalized or not, those types of things where we want our community members around the state to have a sense of what's going on, and so we utilize our report card for educating people. The other thing that we really want to make sure that people understand is what the current problems are and how they can address them. And so we kind of tie up all of those pieces within the report card for that purpose. So our higher education report card focused on 4-year public and private schools as well as 2-year colleges. It focused on looking at college campus policies, their social norms, alcohol availability, and really for the first time ever, we began to collect data around what colleges were doing related to alcohol prevention on their campuses. And what we found was that when we started asking the question in Texas among college campuses is that most Texas college campuses weren't collecting alcohol use data. And this was a real problem because that's a real gap. And we began to use that information, the gap of where we don't have data, and presenting it at places like our Department of State Health Services has a strategic planning process, and we participated in those meetings and indicated that we knew that there was a data gap among the 18 to 24 age range, and they made that a priority area when they began to fund local coalitions, the 18 to 24 age range, in collecting data. So there's ways for us to use our report cards to inform decision makers and also to ensure that the readers understand where to find evidence-based strategies such as, the CDC or NIAAA or the Surgeon General, because we often find the community members have no idea where to go for that type of information. We also want to make sure that we collect relevant data, and I'm noticing here that my bullet points are coming up one by one. So to kind of point out that identifying how youth obtain substances is important, how you tell the story of your community, as I was indicating, between gaps, readiness, how you begin to have a conversation about the data is really what makes the data relevant to people and helps them understand that there are strategies that they need to select and implement. A report card or data in and of itself on a shelf is not really all that helpful. So we keep in mind what do people believe about the problem and what's the truth about the problem, and we try to point out the truth and dispel the myths. And we ask questions around how can we show problems that a community is facing and then show opportunities for us to create change. So in particular, we look for what we describe as the aha data points, which makes people kind of sit back and go, oh my, I had no idea. So an example of that would be a data set that we found specific to young women through around ages 18 to 21 from the Texas Department of Public Safety arrest data. And we looked at changes over several years between 17, 18, 19, 20, and 21-year-olds, and we found that there was, in some cases, nearly 110% increase in arrests for underage alcohol use violations from 17 to 18 or 18 to 19. And these were huge percentage points for people to get in trouble, for girls to get in trouble for alcohol use. And their trends were outpacing the males, and it gave us an opportunity to talk about all the other risky behaviors that go along with underage alcohol and risky alcohol use, such as sexual assault or unwanted, unplanned sexual activity. And this very clearly demonstrated a need for prevention and created a level of readiness for people to respond. It showed a gap in some of the work that could be done in a community, like whether or not we have adequate enforcement of the laws or whether or not we had enough prevention activities going on. So this information was how we began to move people from belief to truth and enabled us to effectively address the problem, which we believe is really essential to creating community change. So one of the ways that we think one of the things that we believe is most important is how you present the information. We think presentation of the information is key. So several things that you'll notice about our report cards, which are all available on our website, is that we don't write our report cards for experts. We write them for the average person who probably doesn't know much about the issues, and we look at what actions we can take to create positive change, and we make a connection between the data and our audience. And to us, that's really important so that people can see themselves in the story. And that's where we think the key happens, is when they can see their niece or their daughter or their son or their brother, or that's in the story of the problem. And we talk about keeping it simple because the target audience just isn't going to be, except for maybe us on the phone, they're not going to be experts in this issue. And so a lot of times we expect people to be experts in the issue, and we talk to them and treat them as if they are, and they don't know the basic information they need to know. So we try to make sure that we don't treat things as in-depth in our report cards and how we present, kind of building our collaboration whenever we're presenting information, that we keep it at the level of our audience and not at the level of those of us who work on this on a day-to-day basis. So it's not treating them as if they're not smart, but instead treating them with talking to them at the level that they're at so they can get to the level that we need them to be. And one of the ways that we begin to deliver our report cards, besides the one-on-ones that Tracy talked about, because we do one-on-ones where we talk to people about the information in our report cards, we also begin to increase readiness and collaboration and ability to implement strategies through our regional forums. And you can see here, just from this slide, that we have done a variety of regional forums all around the state. These things are designed to have as much community involvement as possible. We found that in our college regional forums that campuses began to collaborate with community members and law enforcement, so taking on issues like social host and overcoming the statement that we don't have a problem in our community because, and the college campus individual may be discussing our community as in our campus community, because we don't have dorms on our campus, we don't have a social host off-campus drinking problem. But the way the neighborhood saw it is, yes, this is a campus and community problem. And so they began to overcome some of those issues and discussing how can we partner with one another to work on this issue, and that off-campus drinking in social settings impacts both my campus community and my larger neighborhood community. And this was an excellent way for us to begin to talk about how to address these issues. And the data delivery was important, but we also show strategy skill set practicing and demonstrate that, and then also allow people time to practice it as groups. Regarding screening and brief intervention, which I hit on, Texas has nearly 200 campuses. And we knew from data that we were collecting and from conversations that we were having that many were simply unaware of screening and brief intervention and how they could do it outside of a judicial setting or a health center setting. And so that meant that while many of them were aware, most of them weren't using it because they didn't have health centers or judicial settings, especially among the smaller, like the small campuses may have one person who could actually address health-related issues. And if you were a community college, you may be faced with the only folks who are able to help you in your judicial setting, so to speak, are the local law enforcement officers who happen to drive through your parking lot or come on-demand request. So we began to explore ways that we could collaborate with campuses on how to expand screening and brief intervention beyond a judicial setting. So we used some funding that we had from Department of Education, and we started looking at where are students who are alcohol users that are underage and where are the risky drinkers. And we pretty quickly realized that they were, a lot of those students could be found in first-year seminar classes, for example, or perhaps within the Greek system or among that athletic department. And we began to look into how could we promote this as a public health focus and a school performance focus versus you're in trouble for drinking underage. And so we really wanted to reduce the drinking underage, but we began by focusing on this health and school performance focus. And right now we have CSAP, Center for Substance Abuse Prevention Evaluation Enhancement Service to Science mini grant, and we have found through that evaluation that we actually are successfully having positive results with implementing our screening and brief intervention in these settings. And that brings us kind of to the following, the wrap-up slides, which are around how do we engage people. Well, we look at all of our partners as people who conduct work with us as people that we use engagement tools with. And so the list that you have here are ways that we focus on working with people who are engaged in our work groups. And so these are different than our outreach and communication tools, which would include things like general trainings or social networking like Facebook and Twitter, and our e-newsletters or other newsletters. So those kinds of outreach tools we treat quite differently than the kind of engagement tools that we believe are necessary for us to really engage people in the grassroots organizing. We also focus on key constituents for collaboration, and these are some of the folks that we would consider key for collaboration. And, you know, in particular with youth, we host a youth leadership council that is statewide, and it advises our adult members of our coalition, and they participate in strategies and help us implement strategies as well. So they are, and that team is both college and high school students. We also have some considerations when thinking about college campuses in particular. We look at all of these different considerations because each of these types of issues will impact the culture of the campus and the approaches to working with them differently. If it has a health system or not, does it have a law enforcement office or not? Does the campus have a dual track? And by that I mean with a local high school, and are those students treated differently than other students who are on campus? Do you have a small campus where a lot of students are participating in activities in the community with high school students? There are a lot of things that we think about in that regard around transitions. And then the last things that I'll point out here is around community readiness. At the end of the day, we believe that you have to have community readiness to create change on alcohol, tobacco, and other drugs, and therefore you must, look at the degree of awareness of the problem, willingness to accept help or take action, resiliency and capability to make changes in their attitudes and behaviors, all within the target community. So all of the things that we talked about today, the report cards, the regional forums, screening and brief intervention, they not only have had positive evaluation results, we really have increased our ability for our coalition to achieve change in underage drinking prevention because we really focused readiness in our target community. So at the end of the day, we have begun to see these results that are on the screen right now, in addition to the results in the capacity growth and the sustainability of our organization and our overall goals of making alcohol, tobacco, and other drugs irrelevant in the lives of youth. And that's all I have for you.
Thank you so very much, Nicole. We have Nicole's information, or you can find Nicole's information and everything about Texas Standing Tall at her website here, www.texasstandingtall.org. We encourage you to take a look. So with that, we have another Q&A period. And so our first question is from Carlos. And Carlos asks, can you recommend a manual or guide or established model for community organizing as a strategy for preventing underage drinking, or a web source for that matter?
The things that I use with my staff are things like, and this would not be specific to underage drinking, this would be specific to grassroots organizing, which is the tactics that we use to do our coalition work. So one of the things that I direct them to is Midwest Academy's Organizing for Social Change. It's kind of a hard book to find now, but they do have a website, and that I find is a very good tool for people to understand kind of and basic terms, those many concepts we were talking about.
Great, that sounds wonderful. We also have another question from Lori, and Lori asks, how effective is the alcohol abuse awareness training that incoming freshmen are required to take before the semester starts?
Tracy may know that more specifically from a data standpoint than I know. And I do know that it is effective if it's collecting data for people to for the campus to be able to make some strategic decisions around strategies they might implement or programs that they might utilize. And I do know that there's some that actually pop up, you know, and I can't remember the name of any of them in particular right now, maybe Alcohol EDU, that pops up, you know, how many hamburgers this equals and how many when you drink this much and so on and so forth. And those show impacts of having at least temporary, you know, at least acknowledgement of how much I drink impacts how much money I have in my pocket and so forth. But I think you could look at a lot of you know, recommended strategies from NIAAA and other places that would indicate that you need integrated strategies, not just one. So if you were using it by itself, it wouldn't be as effective as using it with multiple strategies.
Great, thank you, Carrie. I have one other quick question for you from Tammy. She asks or mentions that she collects excellent data on their campus and share the data on a regular basis. However, she doesn't know that they're really telling a story with it, and she was wondering if you could share some specifics on how you are doing that.
We've done hour-and-a-half workshops on that. The thing that I would look for is, the first thing that I always look for is what is it that people think that they know that they don't know. So for instance, mostly the boys do this and it's a rite of passage, and alcohol use looks like it used to look. Like, so for instance, the parents might think, oh, I did this when I was on college campuses, and they don't know the drinking rates or the level or the types of games that are going on or things that data might show that are shocking. Like the women data, the public nuisance and public intoxication and that kind of data that we began to show shocked people. So we could tell a story that was different than what the story they had in their head. They had a story in their head. Most people do. And so what we wanted to show was the story's different than what you think it is. It's different than what they see on TV when they drink and they all get home safe. So that's the most simplest way I can say that we use that technique.
Thank you so much, Nicole. That was very thoughtful, and I have a feeling that when Carrie begins, I think that she'll be able to speak to that as well. So without further ado, Carrie from Bloomington Normal Community Campus Committee in Illinois.
Yes, I thought maybe I could go incognito if everybody thought I was from Indiana. Hi, everybody. My name is Carrie Calvert, as I said, and I think what you'll find in our presentation is that I'm actually drilling down to a lot of the things that Tracy talked about. And you'll see how we've actually done many of the things that she suggested the research supports as effective. But I'm pleased and honored to be representing our coalition on the call. And I just want to also point out that we're not experts, that we just keep plugging away on this, and just keep doing the best we can. Just a little bit about our coalition. Bloomington and Normal are twin cities in central Illinois, and between the two cities we have four institutions of higher ed and 5 high schools. So our students are moving back and forth across those institutions. They often live together and they socialize together. So we have a lot of students in our two communities. The coalition that we formed out of was addressing alcohol and drug use in the junior and high schools, but what we recognized was that it wasn't really addressing the needs of the universities at that time. And so we formed a subcommittee, and we did that in 2005. You can see our current partners. We have enforcement, we have city government, we have all of the universities represented, we have the hospitals and health agencies, and each of these organizations bring a different perspective and a different expertise to the table, which is really important when you're forming your coalition. As Tracy and Nicole both mentioned, some of the skill sets that we've realized we need are effective leadership. You need someone who can lead and effectively lead your coalition, and a champion who can keep the group moving forward. Strategic planning skills are vital, and also the ability to understand that there are systems that you have to work within and recognize is another important strategy. One of our members often points out that our audience is continually changing, which makes it hard to feel effective because we're continually repeating efforts that feel old to us, but that are new to students. And so persistence and patience are needed in large amounts. This work is slow, it's very incremental, and it's easy to lose sight and get discouraged. So you just got to hang in there and kind of keep your eyes on the long away horizon. And then connections to local governments definitely help. Some of our coalition members had developed relationships with town council members during a smoke-free initiative. So when we were ready to start working on alcohol issues, there was already trust established there. And so that helped ease the way in to a lot of the work that we did because those folks already trusted us. Here's some of the data that we collect on a fairly regular basis. We look at admits, alcohol and drug survey data, both at the high school and the college level. We look at violations on campus, and we often break those down by the week, the day of the week, and also the time of the day. My particular campus doesn't have many classes on Fridays, and of course, what does that mean? That means we see a lot of violations Thursday night and Friday night and Saturday as well, of course. We're even looking at hometowns. That's kind of a new one, but are there hometowns that are sending their students to us and that are particularly problematic? And if there are, is there some way we can reach back into the schools, the secondary schools, to try to address it before it comes to us? We also look at violations off campus, and our enforcement folks are very good about feeding those violations back to the campuses so that when our students get in trouble off campus, we are informed about that. And that goes across the state. We'll have students that are at a university all across the state, and we still get the information fed back to us. We look at compliance check data, and we also look at underage party violations in our county. So you can see we actually collect quite a lot of data. And you can also look back at the partners that we have on our coalition and understand that no one person is providing all of this information, but that we're using the expertise that sits around the table to provide it as we move forward with our work. And this next slide is just a snapshot of some of our local aggregate data that reflects some of the issues that we deal with in our community around alcohol abuse. And you can see from the slide that this is a serious issue in our community. And kind of, as Nicole was saying, you know, telling the story in a way that people can understand. So once we have our data, we begin to look, as Nicole and Tracy have talked about developing a strategic plan and looking at goals that address the aspects of policies, what kinds of system changes we could suggest, and even environmental changes to the built environment that are in our communities. So as Tracy mentioned, she talked about moving from talk to action. What was it we wanted to focus on? And we decided that access was a concern in our community, so that's what we decided to move on. And I'm sure that's a problem in most communities. So an effective strategy that we decided to look at was to reduce access was to work with a responsible beverage service program. At the time that we started, there was one in the community, but it was really expensive and people weren't sending their staff to it. It was $50 a person. And so we, our small group, got together and found out that we could get access to a program that would cost $10 a person. So we decided, maybe in our ignorance or whatever, but we decided that we would take on a responsible beverage service training program and implement that in our community. And so we sent several folks off to get trained, and then we jumped right in. So since we started doing that in about 2005, 2006, we've trained over 500 people from 65 different establishments in our communities and actually in our county as well. Within the past year, the training actually moved to our local community college, who is now offering the program. So our coalition is no longer in charge of it. It's become institutionalized within the community college, therefore ensuring sustainability, which really is the point of much of this work, is to move things to the point where it's absolutely sustainable within your communities, and you don't have to put all the effort out that you might once have had to get something going. So this was our first accomplishment, and we felt pretty good about getting that up and off the ground and getting our work done. So then we kind of looked around and said, okay, now what? So we decided to focus on keg registration, partly because another university in Illinois had passed a keg reg ordinance, and it was being really useful in helping to track buyers of kegs. We had a lot of house parties, and everyone was under 21, and police officers had no way of knowing who purchased the keg. And so we hired a consultant, and he helped us draft the ordinance, and then he also helped us develop talking points for the student government associations and the town councils. And we went on ride-alongs with the police. We took pictures of the kegs at house parties. We took lots of pictures of kegs at house parties, and we used those pictures in presentations to assure the councils and our student government associations that the keg registration was needed. In our blissful ignorance, we thought that this was low-hanging fruit, sort of, perhaps because the class, we got that up and running so quickly, and it just went like a piece of cake. But it actually took 2 years and many, many, many council meetings later. But eventually we did get the keg registration ordinance passed in both cities. And our enforcement folks tell us it continues to be very effective in helping them identify who purchased the keg. They said they walk into parties and say, okay, where's your keg reg form? And everybody goes, uh-oh. So it's been effective in helping to move that forward. We continue to focus on access. We've gotten funds to help our law enforcement increase the number of party patrols that they're able to do, and also the number of compliance checks. And in both Twin Cities and in the county, they've been able to increase the number of compliance checks, holding our establishments, more accountable to not serving underage, and so again, reducing that access to alcohol by our students, both of age and underage. We've also were able to get some UDOL grants enforcing underage drinking laws, and ISU was able to increase enforcement in the residence halls, and Wesleyan was able to coordinate efforts between Wesleyan Security and the Bloomington Police with that UDOL grant. And one of the outcomes of having that UDOL grant on their campus was that the Bloomington Police became much more aware of the locations of the buildings on their campus. So when there are more serious, well, not that alcohol is not serious, but when there are other things going on campus, the police are now much more familiar with their campus than they were prior to the UDOL grants, when it was just the security force patrolling the grounds. So that was sort of an unexpected outcome, but a very positive one. We've also done 2 social marketing campaigns. This one was called the 0013, and it was really focusing on the college-age students and the communities to have more of a harm reduction focus. How can a person drink in a way that will keep them safe and at lower risk? We always tell our students, if you're underage, you're still at risk for getting a ticket just because you're underage. But if you're going to choose to drink, how can you do it in a way that will keep you safe and keep your academics safe? And this particular campaign was very popular as we used students in the advertisements. And it was also easy to remember. The 0013 kind of rolled off. And this campaign it's ongoing right now. It's focused in high schools, but it's really targeting parents. And as Nicole was saying, talking to parents, and Tracy as well, about how not to provide your teenager with alcohol, about how to have a conversation with your student about drinking and make your expectations very clear, and that actually your student will appreciate knowing the boundaries around that. To not host parties, to not hold those keys, just not to do that, and to share health risks around alcohol and future career implications that might occur if a student chooses to drink. So this campaign is going on in our high schools, and this next slide actually shows one of our coalition members at a high school event. And again, it's targeting parents about talking with their students about alcohol. And one outcome of the coalition, which we probably didn't realize at the time, but that has certainly developed with time, has been really strong lines of communications between our university administration, our police departments, and the town councils. For example, Bloomington has what they call an entertainment district, which has a large number of bars. Their city council formed a task force to address some of the issues that come with a large number of bars, such as violence, over-service, parking, public urination, and how to get rid of 2,000 people when the bars close. The BNCCC was invited to be a part of this task force, which to us was really a sign of how much respect and trust they had for our coalition. Another example of the lines of trust that have been developed was the canceling of Fools Fest. Fools Fest was created by a student who wanted to create a large event on ISU's campus, which was similar to some of the large drinking events at other campuses. He invited people via social media to come to Normal, that's where we're located, Normal, Illinois, and drink during April Fool's Weekend, which was why it was called Fools Fest. Because of the relationship that was already established between the police departments, universities, and the councils, the response was very swift. The president wrote a letter to parents. The residence hall folks closed the residence halls to guests. So if you were coming from out of town, you weren't going to be able to have a place to stay unless you went to a hotel. And the town councils enacted emergency ordinances to close the liquor stores at 10 p.m. So basically, there was this very strong response almost immediately across the universities within the community. Fools Fest fizzled and was a non-event, much to the relief of all the administrators and the authorities involved. And although our coalition wasn't really directly involved in the efforts, we really firmly believe that having the coalition helped those relationships develop and flourish, which enabled the quick shutdown of the Fools Fest. So again, I'm not sure that is an outcome that we might have worried about or thought about, but it's definitely been a strong outcome. One of the other things that we do on a regular basis is to to present and report and share. We usually go ahead of the town councils about once a year and just sort of remind them that we exist and what we're working on and update them on any new things that we might be doing. We also take advantage of opportunities in the newspapers, on our website and Facebook page to just kind of always be putting our message out there and reminding people that we're here, we haven't gone away, and we're still working on this issue. Some of the challenges of coalitions that I was asked to address, these are the ones that we've struggled with. The public health model, helping folks understand that when you're on a coalition, you really need to work at the organization and policy level, that you've got to move beyond the individual focus, and you have to look at your community as a whole. So that continues to be a challenge, especially with newer members, kind of understanding how that model works. We've had differing philosophies. The high school areas has the no use philosophy. The colleges tend to use the harm reduction, and that has caused some issues and concerns over time. Part of the way we've resolved that is we have subcommittees. We have a subcommittee that's focusing strictly on the parent information right now, and then we have other subcommittees that work with the universities. So we recognize that those are both important messages that our coalition can address, but perhaps different people need to be addressing them. We've had funding shifts. Initially, and I'm sure a lot of you out there know this, much of the money was for universities. But over the last few years, the funding has shifted more to high school. So what does that mean for your coalition efforts? Well, for us, what it meant was that we kind of had to come together again and say, okay, we're not getting any money out of this, the universities, and all the money is going to high schools. How can we make this work? And so we decided to put funding towards our party patrols and the compliance checks, because that hits both our high school students who are attending the house parties and the college students. So it's a way of kind of marrying those differing philosophies. Somebody, I think it was Tracy, talked about fatigue and burnout. This is hard and, for the most part, fairly unrewarding work. Nobody walks up to you and says, hey, great job on that alcohol thing you're working on. So you have to make sure you celebrate the successes as they come. And that's really important. And just always keep that long view. Remember the patience and the persistence that I mentioned earlier. And we still struggle with unrepresented groups. We have a hard time keeping the faith community going on our coalition, and also the local retail establishments aren't always represented. And we're actually currently revising our strategic plan. And as you can see, some of these things were ones that Tracy and Nicole talked about. Do we look at alcohol density? As I mentioned, one of our Twin Cities has a lot of bars, and there's a constant turnover. So what do we need to be looking at? Is that an issue we need to be putting our focus on? What about increasing taxes? Illinois' beer tax is quite low. Is that something that we could work at? When I heard Nicole say 10 years, I was like, oh boy. What about alcohol ads in student newspapers? Is that something we could tackle? So again, these are just ideas of where we might be heading in the future. And just that it's always, think of your strategic plan as a dynamic document. And that it's always going to be changing as you tackle some things and move forward and accomplish, add something else onto the list. So I hope with this presentation I've shown you some ideas of what one community coalition's been able to achieve. One of our consultants used to tell us that you have to have 1,000 cups of coffee to do this work, and it really is about building relationships and trust. And once those are in place, the work and the focus becomes much easier, and you can see some light at the end of the tunnel. Here's my contact information. Feel free to email me at any time if you would like. And with that, I am done with my part.
Thank you so much, Carrie. What's such a wonderful story of what's happening where you are, and really concrete strategies that really helped bring to life what Tracy was talking about in terms of research and best practice, and what Nicole was talking about in Texas. So I greatly appreciate it. We're going to answer your questions in just a moment. What I would love to do is just share a couple of takeaways for all of you, and then start pulling up our feedback form. But let me just go through just some final thoughts. So each of our presenters, Tracy and Nicole and Carrie, shared wonderful presentations that spoke to the challenges and opportunities of collaborating to reduce underage drinking. And listening to your presentations, I heard a number of salient points for us to remember. First, when collaborating to prevent and reduce underage drinking, it's important to focus on making environmental changes. This is especially the case since the process of collaboration is critical to achieve that kind of environmental change. Please ensure your collaborative partners have the skills that's needed to make change. It's important to have a variety of folks at the table together. It only makes you stronger. It's really important to conduct assessments to assess your strengths and needs, and to select strategies that align with those assessment findings and have been proven to work. Make the most of your limited resources, especially if you have partners coming from different areas. Capitalize on what people are bringing to the table. And finally, and most importantly, take action. So for more information about the ICPUD series, and then for upcoming webinar events, et cetera, please go to the website here, stopalcoholabuse.gov. And then again, as I had mentioned at the top of the presentation, we are about to present a series of brief questions over 3 slides for your feedback on today's webinar. Please stay with us, especially as I raise some questions for Carrie, and Tracy and Nicole are welcome to jump in as well. But please share your feedback. We greatly appreciate your opinions, and we'll use them to improve future events. Okay, so Daniel has a question for you. Are treatment providers and college students included in your coalition, and if so, how?
Do we have treatment providers at the moment? We have people from our mental health agencies. I'm not sure we have a specific provider, although we have counselors on our coalition who work at the universities. And for students, that's a hard one to keep. We have a hard time keeping them because, you know, their class schedules change and whatever. We certainly want their input. I know that at Illinois State, we have a task force, and I actually have a group that meets once a month at night because that's the only time I can find students available, and we kind of pick their brains at that point. So yeah, it's a struggle to keep students on the coalition because, you know, of their ever-changing nature of their jobs, their class schedules, etc. But we definitely try to reach out, and there are some high school students working with the parent campaign.
Thank you so much. We had a question from Lee, and she asked whether you have a party patrol protocol.
Party patrol protocol. Well, that is done through the local law enforcement. I'm not sure what that means. We have in Normal, we have a patrol that works from 6 p.m. to 4 a.m. and that they're taxed with going around and dispersing parties and dealing with the folks who are hanging out of windows and, you know, doing all the things that make it quite obvious, you know, 100 people standing in the front yard with red cups. So that's their main job is to address the parties, and they're not focusing on other law enforcement issues. Again, I'm not sure what the protocol, I'm not sure what that means, but it's all run through our enforcement folks.
Okay, well, I want to thank all of our presenters, Tracy, Nicole, Carrie, as well as David Epquith from the U.S. Department of Education for joining us today for such wonderful, thoughtful presentations on a really important piece to preventing underage drinking, and that is really bringing the community together to make change. So what I would like to do is ask that you all continue to complete the feedback form. Again, we'd greatly appreciate it. And we look forward to your participation on future ICPUD webinars, as well as the National Center on Safe Supportive Learning Environment webinars. And we hope that you all have a wonderful afternoon. Thank you so much, and have a great day.